In this class, we learn about a disease called as sickle cell anemia. This sickle cell anemia is an autosomal recessive disorder where there is a point mutation, and this point mutation will occur at the sixth codon, that too in a beta globin chain. And this mutation will occur at the single nucleotide. This is a single nucleotide mutation, and this causes change in GAG to GTG. That means A is replaced with T. That is a single nucleotide mutation. That means this glutamate amino acid is replaced by valine. This replacement of glutamate with valine will occur in a beta globin chain, and this causes formation of atypical hemoglobin. And this atypical hemoglobin is called as HbS, and this causes change in the shape of RBC, that is sickle shaped RBCs will be formed in the sickle cell anemia patients. This change in the shape and this change in the globin chain also causes change in the hemoglobin, that is it will affect hemoglobin oxygen carrying capacity. It will be decreased in the sickle cell anemia. So this amino acid substitution will cause formation of a sticky patch. This sticky patch will be seen on beta chain in both oxyhemoglobin and deoxyhemoglobin. So normally deoxyhemoglobin will have hydrophobic cavity, and normal hemoglobins doesn't have a sticky patch. Only sickle cells will have a sticky patch. That is, sickle cell disease will have a sticky patch on their hemoglobin. So we'll see the structure of this hemoglobin in normal persons, and in sickle cell disease patients. First, we'll see normal oxy and deoxyhemoglobins. And hemoglobin is a tetramer. It has beta 1 subunit, beta 2 subunit, alpha 1 subunit, alpha 2 subunit. This is an oxyhemoglobin. This is oxyhemoglobin. And we have deoxyhemoglobin. That deoxyhemoglobin will have a hydrophobic patch, and they have 4 subunits. Alpha 1, alpha 2, this is beta 1, beta 2. This is an hydrophobic patch or residue, or you can call it as a cavity. This hydrophobic patch is between phenylalanine at 85th position and at the leucine, which is at 88th position. The patch is seen in between these two amino acids. So this is a deoxyhemoglobin. In what happens in sickle cell disease? This is a hemoglobin, oxyhemoglobin. We have, for easy understanding, I'm writing the subunits in a different way so that you can understand easily. And this is alpha 1, alpha 2, and we have a sticky patch on the beta globin chain. Okay, this is an oxyhemoglobin, yes, sickle cell hemoglobin, and we have a deoxy structure also. This is beta 1, beta 2. For understanding, I am writing subunits like this. Okay, alpha 1, alpha 2. What will happen? This is a deoxy HBS, which will have sticky patch also, and this is an hydrophobic patch. This is a sticky patch. So deoxyhemoglobin will have, hemoglobin S will have both sticky patch and a hydrophobic patch. This is a sticky patch, and this sticky patch is that means this sticky patch will bind with this hydrophobic patch. That means this sticky patch will bind to complementary hydrophobic patch. Binds to complementary hydrophobic patch. In HBS. And this will cause linking of two tetramers together. That means this is a sticky patch and we have a complementary hydrophobic patch, so that this is beta 1, this is beta 2, this is beta 1, this is beta 2, and this is alpha 1, this is alpha 2, this is alpha 1, this is alpha 2. So this sticky patch will bind with the hydrophobic, complementary hydrophobic patch, and there is a linking of this two tetramers, and this causes more tetramers linking, more tetramer linking, and they will form a polymer, and this is a linear polymer is formed. And 7 of these strands like 7 strands will be taken together, 6 7, and they will turn together and they will form a fiber. They will form a fiber. All these together, they will form a polymer. 7 of these strands associate together and they will form a fiber. And polymerization this polymerization converts flexible red cells into stiff sickle cells. That means normally this type of cells are converted into sickle shaped cells. This shape, this is stiff, this is stiff, this is a sickle cell. And this polymerization will not polymerization will not occur in oxygenated blood. Why doesn't it occur in oxygenated blood? Because complementary hydrophobic site is not exposed. If you see the structure here, this oxyhemoglobin S doesn't have any hydrophobic patch, and here also oxyhemoglobin doesn't have any hydrophobic residue. Only deoxyhemoglobin will have an hydrophobic patch. So that means oxygenation will decrease sickle cell formation. Oxygenation will decrease sickle cell formation. That's why sickle cells are not seen in oxygenated blood. And normal deoxyhemoglobins doesn't have any sticky patch, but they will have a complementary site, but they doesn't have any sticky patch. Then these sickle cells will bind to endothelium by selectins. So they will bind with the endothelium, and these sickle cells, they cannot pass through small venules, and they will cause vaso-occlusion. And these sickle cell binding with the endothelium will invoke inflammatory response. Inflammatory response will be seen with this sickle cell attachment to the endothelium, and these sickle cells will be hemolyzed when they are passing through small venules, because they have a stiff nature. Sickle cells will have a stiff nature, which will cause rupture of their cell membrane and causes hemolysis. Hemolysis will occur in sickle cell anemia. Normal of RBC is 120 days, but sickle cell will have less than 20 days of lifespan. Less than 20 days of lifespan. And this is about biochemical basis of sickle cell disease. Now we'll see diagnosis of sickle cell anemia. How will you diagnose a sickle cell anemia patient? So we have a sickling test. What you will do sickling test? Here we'll take blood from patient, and that blood we'll do a blood smear, and blood smear is prepared by adding a reducing agent. What is that agent? Reducing agent? Sodium dithionate. This is added to the blood smear. So, and you will observe in a microscope. Observe in microscope. What you will see, this reducing agents will cause formation of sickle cells. This reducing agent will help in formation of sickle cells in a sickle cell anemia patient's blood. So you will see sickle cells. In a normal person, this reducing agent doesn't cause formation of sickle cells. Normal patient with sodium dithionate, there is no sickling. Only sickle cell anemia patient will have sickle cell formation. Next, we will do electrophoresis. Electrophoresis of patient blood. And this electrophoresis is usually done for sickle cell screening. And patient's blood is used for finding out hemoglobin, abnormal hemoglobin, and this is done in an alkaline pH. And what happens here, there we will see different types of migration. Normal person blood, if you see that, if you know the normal, then you can find out abnormal easily. This is an electrophoretic slide, and we will apply sample here. This is origin. We have three types of hemoglobin: HbA, HbF, and HbA2. HbA2 will be here near the origin. It will move slowly. This is HbA2, and this is HbF. This is fetal hemoglobin, HbF, and the last one is HbA. HbA. This is adult hemoglobin. So this is the normal pattern. What happens in sickle cell sickle cell disease? So this sickle cell disease is of two types. One is heterozygous. That means one mutant gene is inherited from one parent and other normal inheritance from other parent. That means only one gene is mutated and other gene is normal. That means this patient is called an heterozygous patient and it is a sickle cell trait. It is called as a sickle cell trait. But when we have other condition called as homozygous, in this both parents contribute to mutant gene and this is a sickle cell anemia. So these are the two forms which we have in sickle cell anemia. For a normal patient, this is an electrophoretic pattern. We have to see the electrophoretic pattern of both this sickle cell anemia and sickle cell trait. For sickle cell trait, if you take HB electrophoresis, in this patient will have HbA, they will have HbF, one more band that is called as HbS band, and they will have HbA2, and this is origin. So this is HbA2, this is HbS, this is HbF, and this is HbA. That means in a sickle cell trait patient will have a adult hemoglobin also. Along with the sickle cell hemoglobin, adult hemoglobin is also present. But what happens in sickle cell anemia? There is no adult hemoglobin, only HbF will be there, and this is sickle cell band, sickle cell hemoglobin, and HbA2 will be there, and this is a origin of application, that is application site. This is HbA2, this is HbS, this is HbF. There is no adult hemoglobin. In electrophoresis, we have a negative end and a positive end. In a normal person, hemoglobin A is present. That hemoglobin A has a glutamic acid. This glutamic acid will provide negative charge. This negative charge causes rapid movement of HbA towards positive pole, and that's why HbA is the first band to appear in the electrophoresis towards the positive pole. What happens in sickle cell disease HbA is glutamic acid is absent. That means there is less negative charge. Less negative charge. That means there will be slow movement of HbS towards positive pole. That's why the movement is slower and we'll have a separate HbS band in electrophoresis. This is the basic mechanism which helps in separation of HbS in a blood sample through electrophoresis. And the other investigations which we will do is HPLC method. In this HPLC method, different types of hemoglobins are separated, and sickle cell anemia can be associated with other abnormal hemoglobins. That means the sickle cell anemia can be associated with thalassemia. It can be associated with HBC disease. It can be associated with HB, HBFH. Like this, sickle cell anemia can be co-associated with thalassemia, HBC and HBFH. These all diseases can be this type of sickle cell diseases can be separated by HPLC. So we'll have both sickle cell and beta thalassemia disease patient. That means patient will have sickle cell anemia and beta thalassemia. In this, patient will have HBC disease and sickle cell disease, and in this patient will have HBS and HPFH type of hemoglobin. So the patients will have both diseases. These can be separated with the help of HPLC method. This is a type of chromatography, high performance liquid chromatography. And this is about biochemical basis and diagnosis of sickle cell disease.